You've stared down the medical gauntlet of a stroke. You're navigating the challenging road to recovery. Your focus locked on healing. And then, out of nowhere, your appetite stages a hostile takeover. Suddenly, you're possessed by an insatiable, snack-seeking gremlin you barely recognize, capable of decimating the fridge contents with the ferocity of a famished wolf pack. What in the name of balanced nutrition is going on? What if this bewildering surge in hunger, these relentless, often specific cravings, aren't just a quirky personality shift, but a complex tapestry woven from physiological changes, emotional whirlpools, and maybe even the very medications designed to help you? Forget simply gritting your teeth and relying on willpower alone. We're about to decode the surprising culprits behind your post-stroke hunger games and unveil potent, practical strategies to manage those cravings, arm yourself with healthier choices, and finally reclaim control over your runaway appetite. The blueprint for taming this beast starts now. It's a cruel irony. Just when your body needs optimal, controlled nutrition to repair and rebuild, many stroke survivors find themselves wrestling with a completely revamped, often supercharged, appetite. This isn't a minor case of the munchies. It can be a profound, persistent hunger that feels almost impossible to satisfy, leading to overeating and unwanted weight gain, which can introduce new health risks. Let's be clear. This is rarely a simple failure of willpower. There are often very real, very powerful forces at play. Culprit number 1. Medication mayhem, the pharmaceutical plot twist. The medications prescribed after a stroke are vital, often life-saving. However, some common culprits, like certain steroids, often used to reduce inflammation, some anticonvulsants, if seizures are a concern, or even some types of antidepressants, can come with a notorious side effect: a significantly increased appetite, specific food cravings, and potential weight gain. It's like a switch has been flipped in your brain's hunger control center. The crucial, non-negotiable point here? Never stop or alter your medication regimen without explicit instructions from your doctor. But understanding that your meds could be a contributing factor is the vital first step to having an informed conversation with your healthcare provider about managing this side effect. Culprit number 2. Emotional eating, the deceptive comfort of calories. Recovering from a stroke is an emotional roller coaster. You might be grappling with stress, anxiety about the future, frustration over physical limitations, periods of depression or low mood, or even sheer boredom if your activity levels have drastically changed. In these vulnerable states, food, particularly those high-carb, high-sugar, high-fat, comfort foods, can become a powerful, albeit temporary, coping mechanism. That chocolate bar, that bag of chips, that tub of ice cream offers a fleeting hit of dopamine, a momentary distraction from difficult feelings. Your brain's reward system gets hijacked, and before you know it, you're reaching for snacks not out of physical hunger, but emotional need. Culprit number 3. Boredom and the new normal, the idle hands and mouth syndrome. Post-stroke recovery often involves a significant shift in daily routines. Reduced mobility, time off work, or fewer social engagements can lead to long stretches of unstructured, idle time. And what's a common human response to boredom? Snacking. Eating can become a way to pass the time, a readily available activity when others are limited. Furthermore, disrupted meal routines, perhaps due to fatigue or relying on others for meal prep, can lead to erratic eating patterns, skipping meals only to overcompensate later with massive portions or unhealthy choices. Culprit number 4. Brain blueprint scrambled? Could your brain's own wiring be playing tricks? While complex and still being researched, a stroke can directly impact areas of the brain responsible for regulating hunger, satiety, the feeling of fullness, and even taste perception. Your internal, "I'm full" signal might be weakened, or your "I'm hungry" alarm might be stuck on loud. Changes in your sense of taste or smell can also play a role. If familiar foods suddenly taste bland or different, you might find yourself seeking out stronger, often less healthy, flavors, more salt, more sugar, more fat, or eating larger quantities to achieve the same level of sensory satisfaction you once did. So, how do you fight back against this multi-pronged assault on your appetite control? With smart, sustainable strategies. Strategy number 1. The Satiety Superstars. Unleash the power of fiber and protein. If you want to feel fuller for longer on fewer calories, fiber and protein are your dynamic duo. Fiber, found abundantly in fruits, vegetables, especially the non-starchy kind like leafy greens, broccoli, and peppers. Whole grains like oats and quinoa ensure textures are appropriate if you have swallowing difficulties. And legumes like beans and lentils does several amazing things. It adds bulk to your food, physically filling you up. It slows down digestion, leading to a more gradual release of sugar into your bloodstream and preventing those sharp energy crashes that trigger more cravings. Protein, found in lean meats, poultry, fish, eggs, dairy products like Greek yogurt and cottage cheese, tofu, and legumes, is also incredibly effective at promoting satiety. Aim to include a good source of both fiber and protein with every meal and snack. This combination is your frontline defense against runaway hunger. Strategy number 2. Smart swaps and healthier choices. Outmaneuver those cravings. This isn't about declaring all your favorite foods off limits forever. That's a recipe for rebellion and eventual binging. It's about making consistently better choices, most of the time. Craving something sweet and decadent? Instead of a processed candy bar or a massive slice of cake, try a piece of fresh fruit, a small bowl of berries with a dollop of plain yogurt, or a single square of high-quality dark chocolate. Hankering for something salty and crunchy? Swap out the potato chips for air-popped popcorn, light on the salt and butter, a handful of roasted chickpeas, or some crunchy veggie sticks with hummus. And don't forget hydration. Sometimes, your brain mistakes thirst signals for hunger pangs. Before you raid the pantry, try drinking a large glass of water and waiting 15 minutes. You might be surprised. If you do decide to indulge a craving, practice portion control. Savor a small, satisfying amount rather than mindlessly devouring the whole packet. Strategy number 3. Mindful eating, your brain's secret weapon against mindless munching. In our hyper-distracted world, we often eat on autopilot, barely tasting our food, completely oblivious to our body's signals. Mindful eating is the antidote. It's about bringing conscious awareness to the act of eating, transforming it from a mechanical function into a sensory experience. How? Eat slowly. Put your fork or spoon down between bites. Chew thoroughly. Minimize distractions. That means turning off the TV, putting away your phone, and stepping away from your computer. Focus solely on your food, its aroma, its texture, its flavors. Crucially, learn to tune into your body's hunger and fullness cues. Before you eat, ask yourself, am I truly physically hungry, or am I eating because I'm bored, stressed, sad, or just because it's there? Eat when you feel genuine hunger, and practice stopping when you feel comfortably satisfied, not painfully stuffed. This also involves identifying your emotional eating triggers. If you notice you always crave ice cream when you're feeling lonely, or chips when you're stressed, start developing alternative, non-food coping mechanisms for those emotions. Call a friend. Go for a gentle walk if possible. Listen to music. Engage in a hobby. Strategy number 4. Structure and routine. Taming the nutritional chaos. When your days lack structure, your eating habits often follow suit. Establishing a regular pattern of meals and planned healthy snacks can be incredibly helpful in regulating appetite signals and preventing extreme hunger that often leads to overeating and poor food choices. Don't let yourself get ravenously hungry. Keep healthy, convenient options readily available and visible in your kitchen. A fruit bowl on the counter, pre-cut veggies in the fridge. Conversely, make less healthy, highly tempting options less accessible, out of sight, out of mind, or at least, harder to impulsively grab. And finally, the most important strategy of all. The crucial conversation. You are not alone. Talk to your healthcare team. This information is designed to be empowering and educational, but it is absolutely not a substitute for professional medical advice. If you are experiencing persistent, significant changes in your appetite, uncontrollable cravings, or unintended weight gain or loss after a stroke, it is essential to discuss these concerns with your doctor, a registered dietitian, or your neurologist. They can help identify the underlying causes, assess whether medication adjustments are possible or advisable, rule out any other contributing medical issues, and provide personalized dietary guidance tailored to your specific needs, especially if you're also managing other conditions like diabetes, high blood pressure, or swallowing difficulties, dysphagia. They are your partners in this recovery journey.